All right, welcome back, everybody, to the deep dive. You guys know how this works by now. You send us stuff that grabs your attention, reports, studies, articles, you name it, and we unpack it all right here. So today we're diving into something pretty remarkable. Someone sent us this report, and get this, it's called A Case of Complete and Durable Molecular Remission of Chronic Lymphocytic Leukemia Following Treatment with Epigallocatechin 3 gallate and Extract of Green Tea. That's a mouthful, right?
Yeah, that title's quite a journey. It was published in Cureus back in December 2015.
2015. Okay.
Yeah.
So before we really get into the weeds with this case, and it is fascinating, we got to do the responsible thing, right? You know the drill.
Standard disclaimer time.
Always.
Yeah, it's that.
This deep dive is for informational purposes only. It's not a substitute for professional medical advice.
That's right.
Always talk to your doctor or a healthcare provider before you make any health decisions.
Couldn't agree more.
Okay. Now that we've got that out of the way, let's talk about why we're here. With this deep dive, we really want to dig into this unique case. We'll look at the details, see what kind of insights we can pull out, and think about what it might mean. But really important to remember from the get-go, this is one single case study.
Exactly.
It doesn't prove a cure, it doesn't prove some kind of universal treatment or anything like that, but it definitely raises some interesting questions.
It really does, and it's kind of a medical anomaly, right?
Mm.
This report focuses on chronic lymphocytic leukemia. We'll just call it CLL from here on out.
Oh,
Now, for anyone listening, CLL is a type of blood cancer. It's actually pretty common.
right.
But here's the thing. It's usually very slow growing.
Okay.
Many people with CLL do eventually need treatment. But the thing that makes this case so interesting is that spontaneous remission, where the cancer just disappears on its own, is super, super rare.
Yeah, you don't hear about that every day.
Not at all.
So we're talking about a cancer where normally you expect some kind of intervention, right? But complete, lasting remission without any intervention, that's like, what, a 1 in 100 chance per year? And even then, a lot of times it's only partial. They don't find all the cancer markers gone. So with that in mind, let's really get into this case. It's about a man who was diagnosed with CLL really young at just 28 years old. That's pretty unusual, right?
Yeah, definitely younger than the average CLL patient. It's more common to see it diagnosed in older adults.
Okay.
When he was diagnosed, he had a few things going on. Enlarged spleen, which is pretty common with CLL. He also had mild anemia, his platelet count was low, and his lymphocyte count was high. Lymphocytes are a type of white blood cell.
Right.
And they actually confirmed the diagnosis after they took out his spleen. They did a splenectomy.
So here's where his story takes this really interesting turn. Instead of going straight for the usual medical treatments, he decided to focus on his lifestyle. He went all in on a healthy lifestyle. We're talking pretty much vegetarian, organic, unprocessed food, filtered water, regular exercise. He was walking and lifting weights. And on top of all that, he's taking a bunch of different nutritional supplements.
It's really amazing how proactive he was right from the start.
Yeah.
He really prioritized those lifestyle changes instead of jumping into conventional therapies.
Yeah, interesting approach. So for the next 12 years, he was in this watch and wait period. That's what they call it for CLL management sometimes. During that time, his cancer did progress a little, but he didn't have any symptoms.
That's a good chunk of time to be symptom-free. 12 years is nothing to sneeze at.
Right. But then, when he was 39, he hit a bump in the road. He developed autoimmune hemolytic anemia. Basically, his immune system started attacking his own red blood cells. And that's when his doctors told him, look, you need treatment now. We're talking steroids, chemotherapy, the works.
Yeah, that's a serious situation. Autoimmune hemolytic anemia can be life-threatening. The usual medical approach is to hit it hard with immunosuppressants like steroids and often chemotherapy to try and get that immune response under control.
So you'd think that's what he would do, right? But no. He decided against the standard treatment. Instead, he added some specific supplements to what he was already doing. Whey protein with lactoferrin, conjugated linoleic acid, and artemisinin, which comes from the artemisia plant. And he kept exercising, even though the anemia was making him feel pretty rough.
And this is where the story gets really wild. The report says that within a few months, he completely recovered from the autoimmune hemolytic anemia. And he did it without any of those strong immunosuppressant drugs. No steroids, no chemo. The authors of the report were blown away. They said it's incredibly rare for an adult with CLL who develops this kind of complication to recover spontaneously like that. In fact, they think it might be the first documented case ever.
Wow, that's huge. A full recovery from a serious condition that was directly tied to his cancer, and he did it without the conventional treatments that everyone was pushing for. Amazing. But the story doesn't end there. Over the next few years, from years 13 to 20 after his CLL diagnosis, his cancer markers, especially his white blood cell count, started creeping back up. By the time he was 46, his white blood cell count was pretty high, but get this, he still felt fine.
That just goes to show how CLL can be. It can be a really slow-burning disease. People can go a long time without any symptoms, even when they have a lot of cancer cells in their blood. It's a chronic condition, and it often progresses gradually.
So at this point, he decided to try something different. He wanted a more integrative approach, so he found a doctor who specialized in integrative oncology. This was a big shift for him, combining conventional and complementary medicine. And a big part of this new plan was a more intense supplement regimen.
Right, and this is where that epigallocatechin 3-gallate EGCG comes in. That's the active compound in green tea extract. They put him on high doses of this green tea extract, plus reishi and chaga mushrooms, which are often used to help regulate the immune system. They also noticed he had some signs of inflammation and some issues with his glucose metabolism, even though he wasn't diabetic. So they added high-dose fish oil for its anti-inflammatory properties, curcumin from turmeric, which also fights inflammation, vitamin D, a bunch of other herbs, and probiotics.
So it wasn't like they just threw green tea extract at him randomly.
Absolutely not. They had scientific reasons for using it. There were lab studies showing that EGCG could actually kill leukemia cells. These were in vitro studies, which means they were done in a lab setting, not in living organisms. But the results were promising. They showed that EGCG could potentially work in a few different ways, like making cancer cells self-destruct and interfering with their growth signals.
Fascinating. So even with all these supplements, the report says his cancer kept progressing. But then at 48 years old, something big happened. They drastically increased his EGCG dose.
Yeah, they bumped it up to a whopping 4 grams a day. And they did that on purpose to match the doses they were using in clinical trials at the Mayo Clinic. They were studying EGCG's effects on CLL patients there.
And that's when everything changed. Over the next 6 months after upping the EGCG, his white blood cell count plummeted, and all the cancer markers in his bone marrow and blood, they were gone, completely vanished. They even used those really sensitive tests like flow cytometry and PCR to confirm it.
And that, my friend, is what we call a complete molecular remission. Now, for everyone listening, this is a really big deal. It means that they couldn't find any trace of CLL in his body, not even under a microscope or by looking at his genes. It's the highest level of remission we have.
So hold on, let me get this straight. This guy lived with CLL for 20 years. He had that serious autoimmune issue. He consistently refused conventional treatments. He stuck to a super strict lifestyle and supplement plan, and then bam, complete molecular remission after they increased his green tea extract. That's mind-blowing.
It's a pretty incredible story, right? So,
Yeah.
And we have to say it again. It's so rare to see CLL go into remission like this, especially a complete and long-lasting remission without any of the usual drug treatments. Spontaneous, complete remissions are like finding a needle in a haystack.
Yeah, so this case is really something special. This guy had CLL for 20 years, and at the end of it all, they couldn't find any trace of the disease. And he never went through chemo or any of those targeted drug therapies that are usually the standard of care for CLL.
It really makes you think about the potential of EGCG, that green tea compound. The report points out that lab studies have actually shown that EGCG can kill leukemia cells. And early clinical trials in humans have hinted that it might lower white blood cell counts in people with CLL. In this case, the timing of the increased EGCG and then the complete disappearance of all the cancer markers is pretty hard to ignore.
You can't help but wonder if there was a direct connection there. But the report does mention that other things he was doing could have played a role too, right? They specifically talked about curcumin maybe boosting the effects of EGCG.
That's right. Curcumin, which comes from turmeric, is known for its anti-inflammatory properties. And there's some evidence suggesting that it could work together with other compounds to make them even more effective at fighting cancer. Plus, this patient had very high levels of vitamin D, and some research has shown a link between high vitamin D and better outcomes for people with CLL. And then there's the fish oil and all those herbs he was taking, which could also help, especially by reducing inflammation, which we're learning plays a big role in how many cancers develop.
So for everyone listening, let's break down what we can take away from all this. This report suggests that green tea extract, especially EGCG, might have been a major factor in this man's incredible remission. It definitely seems like something that deserves more research.
Absolutely. This case also shows us that different things might work together to create a powerful effect. Maybe it's not just one compound, but the combination of multiple natural compounds, along with big long-term changes to lifestyle, they can help the body fight off slow-growing cancers like CLL.
But, and this is a really important point to remember, we have to be careful not to jump to conclusions. This is just one case study.
Right.
It doesn't prove that EGCG cures leukemia, but it's a fascinating story and it gives us some hope.
Definitely. And while the standard treatments for CLL have come a long way, they often don't cure the disease, and they can have some rough side effects and be super expensive. This case opens up the possibility that safe, natural treatments like EGCG might be a good option for some people, especially those who can't handle or afford the conventional treatments. We need more clinical trials to really dig into the potential of supplements like EGCG, curcumin, and vitamin D.
It makes you think about the power of integrative medicine, doesn't it? Combining the best of conventional medicine with lifestyle changes and nutritional therapies.
For sure.
But, and this is crucial, we always need solid scientific research to back up these kinds of findings. And it's always, always important to talk to your doctor or healthcare provider before you change anything about your treatment plan.
Absolutely. This case study gives us a glimpse of something amazing, but it reminds us that everyone's experience with cancer is different. Any decisions about treatment should be made with your medical team, considering your specific situation and medical history.
Couldn't have said it better myself. Well, that was a deep dive into a truly remarkable case. Hopefully you found it as interesting as we did. And just one last reminder, this deep dive was for informational purposes only, and it's not a replacement for professional medical advice. Always talk to a healthcare provider before making any health decisions.
Right.
Thanks for joining us on the deep dive.
See you next time.